Hello and welcome. Well, long gone are those days of pregnancy being a condition that puts women on bed rest for 9 months. Just because a woman is pregnant doesn't mean that she has to stop physical activity. If anything, there's a number of health benefits associated with exercise during pregnancy. Now, these include reduced backaches, constipation, bloating, and swelling. Of course, as we all know, exercise can help boost our mood and energy levels. Of course, it can help you sleep better. And exercising, of course, can also prevent excess weight gain, along with other things like promoting strength and muscle tone. Now, for a long time, however, exercise during pregnancy has been a controversial topic and a confusing topic in recent years. So to help clarify why this is so and how you can best monitor healthy levels of exercise during pregnancy, we welcome our special guest, Rachel Simpson. A little bit about our guest. Rachel is a women's health educator, a physiotherapist, nutritionist and health coach, and natural fertility educator. Now, Rachel's obsession is teaching women how to take control of their health as she teaches women all the things that we never learnt in life and in class at school, that being periods, pregnancy, and pelvic floor. Thanks for joining us, Rach. How are you doing?
I'm well. Thank you so much for having me.
Yeah, and welcome back. Now,
Thank you.
just before we get into all of the questions that I just want to ask you about this topic, firstly, of course, we published your article, and the title is How to Monitor the Intensity of Your Pregnancy Workouts Without Tracking Your Heart Rate, which sounds fascinating. Now, for someone who hasn't read the article yet, can you please tell us what it's about and, of course, what inspired you to write it?
Yeah, well, I think that so many women are really confused about how to exercise safely during their pregnancy. So a lot of women a lot of women these days as well are very active previous to falling pregnant, and they don't want to give that up during the 9 months of pregnancy because it's something that they really enjoy, and nor should they give that up. And I think there's a lot of confusion because everyone seems to have really conflicting opinions about what is safe and what is not safe. And it seems like a lot of people are afraid to give their advice because they don't want to cause an injury or cause a problem. And so everyone sort of tends to err on the side of caution and say, oh, just take it easy. But women who are in that situation, who are currently pregnant and wanting to exercise, they're wanting more information than just take it easy. They want to know specifics about what they can do, what they can't do, what's safe for them and their baby. So I guess that's why I was inspired to write the article about this. And there's some guidelines that have been in place and constantly updated for the last 20-30 years, but unfortunately some people are still living by the guidelines that were popular in the 90s. And I was born in 1990, so these guidelines are as old as I am, and they've been updated, and a lot of women are still relying on these old guidelines. So I really wanted to just make it clear about some of the things you can do that are a little bit easier in terms of monitoring the intensity of your workouts and knowing that you're being safe.
Okay, well, let's get stuck straight into this. Now, why has exercise during pregnancy been such a controversial and confusing topic in recent years then, as you were just alluding to?
Yeah, so I think that as I said, it's causing so much confusion because I think that no one really wants to give a definitive answer. And when it comes to pregnancy, there's no one size fits all approach. And I think that causes a lot more confusion because everyone has a different pregnancy, everyone has a different experience and feels differently and has different symptoms throughout the 9 months. And so some women are better able to tolerate the exercise than others. And so, doctors, family, friends, personal trainers, everyone seems to have their own opinion. And the research and recommendations for safe exercise, as I said, are sort of constantly changing. And so it leads to a lot of confusion. So it wasn't long ago that women were told not to exercise at all during pregnancy. And then, 20 years ago or so, women were told that they can exercise, but that they really should be monitoring their heart rate and keeping their heart rate below 140 beats per minute and don't let it get above 140 beats per minute. But these days, women are sort of just being told to go for it and exercise and do what you feel. And obviously it's causing a lot of confusion. And so the previous exercise guidelines that I talked about in this article that were released by the American College of Obstetrics and Gynecology, so we call them ACOG, and these guidelines are sort of considered the global recommendations for safe exercise during pregnancy. So previous guidelines that were really popular in the 90s recommended that pregnant women keep their heart rate, as I said, below that 140 beats per minute when exercising. But a lot has changed since the 90s. As I said, that's 30 years ago. So research has discovered that the heart rate response, like everything else in a woman's body during pregnancy, it changes from woman to woman. And so The last time I spoke with you, we talked a lot about the changes in the circulatory system during pregnancy, and how this changes quite early on in pregnancy to support the needs of mother and baby during pregnancy. And these changes come in as early as 4 or 5 weeks of pregnancy. So it's really early, and often before we even know we are pregnant. And the problem with the recommendations of the heart rate being keeping the heart rate below 140 beats per minute is that they're assuming that all pregnant women with their heart rate at 140 beats per minute are exerting exactly the same amount of energy and effort during exercise. And if we use our common sense hats here, we know that that's not true. So we know that a set heart rate isn't appropriate for monitoring exercise intensity for all women, whether or not they're pregnant, because the appropriate workout intensity for you is going to depend on how physically fit you are during your pregnancy and how physically fit you were before you were pregnant. So if you're new to exercise, if you consider yourself maybe a little unfit and living quite a sedentary lifestyle, then exercising at 140 beats per minute might be too intense for you. That might be a really hard workout. Whereas if you're an athlete, you're a really active person who's, continuing to run during your pregnancy, 140 beats per minute might be an absolute breeze. And, research now shows that women can reach up to, 170 beats per minute with no negative effects. So obviously we can't look at the maximums just because ethical reasons, we can't do research into those sorts of things. But the new recommendations are now using other things to monitor the exercise intensity during our workout. So not just looking at the numbers on our, fitness tracker and watching the numbers. It's more about listening to what your body is telling you during your workouts.
Okay, so why have the rules changed so often and so much over the last sort of 20 years then?
Well, I think just more and more research comes out. And so, as I said, it's an area that we're more looking into. And I think these days, especially with sort of the gym culture and the active culture that we have, women as a rule are probably exercising more in general than they were, at the age when, say, my mum was pregnant with me. She wasn't going to the gym. But women these days, it's pretty common that we're going to the gym, we're participating in some sort of physical activity, which is great. And so I think that this threshold of 140 beats per minute, people are realizing that for some women, this isn't high enough intensity to really get the benefits of workout. And with everything, the more research that's done, that we have to change recommendations, we have to change guidelines, because new evidence and new studies show different things to what we previously thought. And that's fantastic. We want to keep changing and adjusting to make sure that everyone's as safe as possible.
And do you think for that reason, that's why so many women are confused about how to exercise safely during pregnancy then?
Definitely. So I think it definitely, it changes things, because who you're speaking to about safety during exercise, it's going to depend on what knowledge they have about the changes in these guidelines too. So if you're seeing a GP and trying to get the all clear from the GP about how to exercise safely during pregnancy, they might not even be aware of new guidelines that have come out. They might still be, it depends on their age, it depends on their experience, all that sort of thing. But often they have, it's not just GPs, it's other people as well, but they often have a set thing in their head of, this is my recommendation for this. And unless you're in the know, unless you're actively looking at the research, it's hard to keep up.
Yes, and as you just said, that 20 years ago that women were told to exercise, but to monitor their heart rate. But now, of course, women are pretty much told to go for it. And in that respect, it's almost supported that they do exercise. And as I said earlier on about all of the health benefits, so no wonder that so many women are confused. But if a woman was physically active before her pregnancy, the question is, should she be able to continue her activity in moderation?
Yes. So again, it will depend, and it will depend on a lot of things. It'll depend on how you're feeling. And we would always recommend getting an all clear from whoever your medical practitioners are, whoever your care team is during your pregnancy, because there are some medical conditions that mean that exercise is a complete contraindication. For example, if you have an incompetent cervix or a shortened cervix, and you're at risk of preterm labor, if you have any sort of bleeding, if you have any other sort of medical conditions that are going on, there is sort of a really definitive list of medical conditions and problems where you may not be able to exercise. And so that's why it's really important to get your all clear from the doctor, to know that you are definitely in a position with every pregnancy that you have, that this pregnancy you are safe to be able to exercise. So again, that adds to the confusion, but it is really important to be monitoring monitoring what is safe and what is not for you at this time. Because, you know, some people in their first trimester have horrendous morning sickness, and the last thing they feel like doing is going for a walk or doing any sort of exercise. So it's all about listening to your body. And if you feel the need to exercise, if you feel good about exercising and that's something that you want to do, then I definitely recommend getting that all clear first.
Yeah. And then once you get the all clear, I'm guessing a woman should not try to exercise at her formal level if she is someone that has been actively exercising, doing classes previously. Instead, just to do what is most comfortable for her now. And all in all, it seems like pregnancy is not the time to be trying something new or strenuous activity for the first time either. It's really about sort of understanding your body and knowing its capabilities, and then knowing from that, you know, are you going to be working at 50% and not raising? It's more about the internal body heat as well. Is that right?
Yeah, so you don't want to overheat, because overheating can cause problems for the baby. You also don't want to become dehydrated. You obviously don't want to faint, because that's, you know, a risk in itself. It's those sorts of things. And it's all about listening to your body. So for some women, they can continue at their pre-pregnancy fitness level, you know, for quite a long time. Like I hear of women who are still running at 7-8 months pregnant. And if your body's managing with that, that's absolutely fine. But something else to think about is obviously your pelvic floor as well, and the weight on your pelvic floor, making sure you're not getting those symptoms of leaking and heaviness and things like that at the same time. So, go.
Yeah, so I was just going to say, so if a woman was physically active before her pregnancy, she should really be able to continue activity just in moderation.
Yeah, so it's all about listening to your body. So I'll talk a little bit about the Borg scale, which is the new recommendation for monitoring your exercise intensity. But the really simple one is the talk test. So if you are too out of breath to be able to maintain a conversation when you're exercising, you're probably working too hard. And it's also things like sweating. So you tend to sweat earlier when you're pregnant than normal. And so if you're sweating, if you're puffing and shortness of breath, if you're red in the face, they're signs that your body's working too hard. So it's more about listening to your body and looking out for those signs where you're working too hard, because that's probably not appropriate during pregnancy. But say you're going for a run and you're, you know, a little bit breathless, but you're able to maintain a conversation, you're feeling pretty good, there's no reason why you can't. It's all about listening to your body and looking out for those signs that you are working too hard.
So how does a woman's pre-pregnancy physical level affect the appropriate workout intensity that she should set her target heart rate at then?
Yeah, so maybe this is a good time to talk about the new recommendation. So in, I think it was 2002, ACOG brought out the most recent guidelines, and they continue to review them and update them. In fact, they've reviewed them earlier this year, but they have generally remained the same since then. And they talk about using the Borg scale to monitor your exercise intensity, because this is a way of looking at intensity without needing to track your heart rate. So you might have heard of this before. It's also known as the Borg rating of perceived exertion. And so basically it allows you to monitor your exercise intensity and really think about how hard you're working. So basically there are numbers on this scale, but there are also descriptors. So there are things like working somewhat hard, it feels easy, it feels too hard, it feels like I can't sustain this. They're really sort of simple sentences that help you to figure out what intensity you're working at. And the target zone that we're looking at during pregnancy is a 12 to 14, which is obviously doesn't really mean anything if you're not looking at the scale, but it's a somewhat hard intensity. So somewhat hard. So yeah, I feel like I'm working, but I feel like I can continue for, you know, a set period of time. You don't want to be working intensely for more than about half an hour, 45 minutes during pregnancy, again, due to the overheating and risk of dehydration. But can I sustain this for this amount of time? Am I feeling like I'm able to sustain this intensity for the amount of time that I'm hoping to work out for? So basically this scale, it's all about listening to your body, which is so important all the time, but definitely important during pregnancy. So it allows you to adjust the intensity of your workouts depending on how you're feeling on that day, because obviously some days women feel better than they do on other days during their pregnancy. But it also means you can adjust your intensity of your workouts as your pregnancy progresses, and potentially your physical fitness and your actual comfort levels change as well. So even though your heart rate might still be well below 140 or well above 140, you can look and think, okay, I'm still working somewhat hard. And then as you get towards later pregnancy and you're carrying more weight, you're feeling, a bit achy, a bit heavy, a bit more unbalanced on your feet, then you might think, oh, I'm working a little bit harder. Maybe it's time to tone it back and mean that my walk around the block, I shorten by 10 minutes or something like that. So it's all about modifying, and it gives women the confidence to be able to do that without having to monitor their heart rate and without having to obsessively check something throughout the workout. It's all about just listening to their body as much as possible.
So, in your view, why is a set target heart rate not appropriate for monitoring exercise intensity in all women then?
Yeah, so as I said before, I think it's too much of a one size fits all approach. So it's taking into account, it's basically assuming that all women working at 140 beats per minute are exerting the same amount of energy and effort. So someone who's previously quite sedentary and in early pregnancy and thinking, okay, maybe it's time to get a bit more active, a bit more fit so that I'm feeling good during my pregnancy, their 140 beats per minute might kick in quite soon. And so they aren't working, or they feel like they're working a lot harder to achieve the 140 beats per minute, which may not necessarily be safe for them and their baby. Whereas if you have someone who's previously very fit, very active, marathon runner, loves going for 5-10K runs every week, that person might find that 140 beats per minute is an absolute breeze, and they want to work harder than that during pregnancy. So it's all about individualizing it to the woman and to her unique situation.
So, what I'm hearing, the Borg scale allows women to monitor their exercise intensity without having to track their heart rate during workouts. And the Borg
Absolutely.
scale is all about listening to your body. So, using
Yes.
that scale means you can adjust the intensity of your workout so it feels like you're working too hard or not hard enough, and or based on those numbers.
Yep.
And you can also modify your workouts as your pregnancy progresses and your fitness levels and your comfort levels change. Is that right?
Absolutely. And it sounds a little bit tricky because we're not physically looking at a Borg scale as I'm talking to you, but if you were to look one up, simple Google search and you'll find one, and you're looking for that 12 to 14 somewhat hard, and you look at the descriptors, and it's pretty self-explanatory once you have a look at it, that you can think, all right, somewhat hard. It's not easy, it's not moderate, it's not too intense. I'm sitting sort of there. It's, as I said, the talk test as well.
And the Borg scale gives women a far more accurate idea of how hard they should be working in their workouts during pregnancy. Is that right?
Absolutely, because it's giving them real-time information. Okay, I feel like I'm working at a little bit too high in intensity right now, so I'll take it back a notch. And it's giving them, it's far more accurate than looking at your watch and smart tracker on your watch and thinking, oh, I'm at 120, I can push it a bit harder, even though you're puffing, you're sweating, you're red in the face, you're really needing a rest. It's stopping you from going too intensely.
And as you mentioned earlier, the heart rate response to exercise varies considerably between women and throughout pregnancy. And is there anything else you can tell us about this? Because I understand the whole circulatory system, the heart, the blood vessels, the arteries and the veins will change early on in pregnancy to support the needs of the mother and baby. But these changes may begin as early as week sort of 4 or 5 and may peak during the second and third trimesters. And these change, I understand, tell me if this is wrong, but these changes can cause a heart rate response to increase initially during early pregnancy and will sort of gradually fall during later on in pregnancy. So I just wanted to know your thoughts on that in particular.
Yeah, absolutely. So yes, so often there's a phenomenon that we talked about last time we chatted known as underfill, and basically your blood volume increases quite significantly during the early stages of pregnancy, and this is your body's circulatory system adjusting to your pregnancy hormones, which is causing dilation of blood vessels, and ultimately we are carrying more blood in our bodies, but our blood vessels haven't yet adapted, and that's what causes a lot of our morning sickness symptoms and nausea and fatigue and things like that. And so during this time your heart rate increases in order to get that blood around the body effectively, and so you feel like you're working harder but not doing as much. Like a lot of women who are very early on in their pregnancy will say, oh, I'm already exhausted, I'm already puffed out, and I'm barely a month or two in. But as you progress in your pregnancy, your circulatory system adapts to what's happening in the body, and this phenomenon of underfill will settle down after sort of the end of the first trimester. That's why a lot of the initial morning sickness symptoms will subside at the end of the first trimester, start of the second. So this is similar with your heart rate. So all of those circulatory system responses generally sort of even out and adjust, and then things get a little bit more normal during the second and third trimester. But obviously towards the end of the pregnancy, your heart rate will increase again because you're effectively working harder to do things, because you're carrying more weight, you're carrying more fluid, things like that. So yes, in the end, you are effectively working harder when you're doing less, I suppose.
Of course. So, I mean, during pregnancy, are there any exercises that a pregnant woman should avoid?
I think the main things are being mindful of your pelvic floor. So a lot of people think that pelvic floor exercises and pelvic floor strengthening, things like that, all happens in the postnatal period, but it's really important to be doing your pelvic floor exercises every day during your pregnancy. And so that's really important. And any exercises like running, as I talked about earlier, if you are noticing leaking or heaviness or dragging sensations, things like that during your exercises or during your workouts, it is a sign that you're probably putting a little bit too much pressure on your pelvic floor. So it's important to tone that one back. And it's all about being mindful of your symptoms and how your body's feeling. So things like deep squats, wide legs, like sumo squats, we call them. So if you've got any issues with your lower back, your sacrum, or any pelvic pain, things like that can generally aggravate your symptoms. Anything like asymmetrical leg movements, like lots of stairs, walking, treadmills, running, anything with that, your legs doing different things at different times, basically, that can set off your pubic symphysis pain, your pelvic pain, things like that as well. So it's all about being guided by, if you do have pain, especially any sort of musculoskeletal pain, or even a diagnosis of that, if you've been diagnosed during your pregnancy, which is completely common, completely normal, you really need to monitor your the exercises that you do during your workouts for that reason as well. A lot of women also experience carpal tunnel syndrome during their pregnancy. So in the wrists, where they get pins and needles in their hands and their fingers. And that's really common because we're carrying excess fluid during our pregnancy as well. So if you're experiencing that, anything on your hands and knees, any sort of weight bearing through your hands can really irritate those symptoms, because your hand is in sort of that position. So something you can do instead is do everything on your knuckles. So you can push up on your knuckles or do your 4-point heel exercises on your knuckles, things like that, that can help with your symptoms.
Cool. So what are some safe exercises you can suggest during pregnancy then?
So I think the most important thing is to make sure you're doing a really good warm up and cool down to start with, and to finish off as well. Really, the cool down is really important as well, just to make sure that you're not overheating, excuse me, and that your body is recovering after exercise. And, you really want to make sure that you're preventing injuries there as well. In terms of exercises to do, there's really no limit into what you can do, provided you are feeling well, provided you don't have pain and you're not experiencing any symptoms. So walking is the absolute greatest exercise I can recommend as a physio for anyone. So especially during walking, and it's especially great if you're new to exercise as well, and you're just trying to keep active and stay active as best you can during pregnancy, especially towards the end of pregnancy when you really don't feel like doing much. Walking is the way to go. The only time I wouldn't recommend walking is, as I said, if you have any sort of pelvic pain or pubic pain where you're finding that walking is really aggravating. Obviously don't do it if it causes pain, but if it feels good, then walking is my number one recommendation. Lots of strengthening exercises as well. So again, a lot of women are afraid to use things like hand weights during pregnancy. But if you think about it, once you have this baby, you're going to be lifting the baby all the time, lifting to change nappies and things like that. So you really want to make sure that your arms are strong to be able to lift baby and do things with baby. So hand weights are great, and it doesn't have to be heavy. So you can do a couple of kilo hand weights and just doing really simple upper limb exercises. So your bicep curls, your punches, things like that. Just to make sure that you are in the best possible shape. So I think a lot of people are trying to exercise to get in the best possible position for birth. But once you've given birth, you then have a baby that you have to care for. So you really got to make sure that you're in the best physical fitness to be able to deal with a newborn baby at the same time. So arm strengthening exercises are fantastic, as well as leg strengthening exercises too. So things like squats, again, don't make them too deep, don't make them too wide, but things like squats are really good at strengthening those leg muscles, because the more physically fit you are, the better your body is going to be equipped for labor, which, is a very long process and a very exhausting process. So the stronger and the physically fitter you're feeling, the better your body is able to cope with those demands.
Fantastic. And earlier on, you were mentioning about pelvic floor. So, I mean, could you maybe just run through with us your top 5 things that every woman needs to know about her pelvic floor? For example, what it does, why it's
Okay. Yep.
important, and how to do pelvic floor exercises correctly. Because that's another whole conversation in itself. But
Absolutely,
as
it
an
is.
introduction, yes.
Yeah. So I think a lot of women know of their pelvic floor, and a lot of women know that it's important and it's something they need to do, but not a lot of women know much more than that. So your pelvic floor is basically a sling of muscles that runs from your pubic bone at the front of your pelvis. It runs along and then connects towards your tailbone at the back of your pelvis. So it sits like a sling, and basically it supports our pelvic organs. So that's our bladder, our bowel, and our uterus, of course, as well. And so those pelvic floor muscles, they enclose around the openings to these organs. So we've got our urethra, which connects to our bladder. We've got our vagina, which connects to our uterus. And we've got our rectum, which connects to our bowels. And so when these pelvic floor muscles are strong and working properly, they will squeeze and have enough tension and strength to be able to close these openings, so that we're not leaking when we walk and sneeze and cough and run, and we're able to hold in our bowels until it's time to go to the toilet. And so I think that's the most important thing, to actually know what they are and what they do. They have a lot more function as well. So they're involved in sexual function, they're involved in just all of our pelvic health. So they have a lot of roles, but the main one is obviously to support those pelvic organs. And so how to do the exercises correctly, as you said, it's another conversation in itself. But I think the most important thing to remember is that if you imagine that the pelvic floor muscles are effectively closing those openings, we need to think of it as a squeeze and lift. So the most important thing you can do is to imagine that you are squeezing and lifting those muscles. And the best prompts I can give you here is to imagine that you're holding in a fart, or imagine that you're on the toilet and you're trying to stop the flow of urine. So that squeeze and lift is a way to know that you're doing it properly. The most important thing is not to be bearing down and pushing down, because that can cause problems and cause the opposite effect. So I always recommend getting checked out by a women's health physio to make sure you are doing your pelvic floor exercises correctly. And there are obviously some pelvic floor conditions as well where doing strengthening exercises can be a little bit detrimental and have the opposite effect. So don't always assume that pelvic floor exercises are the best possible thing for you. But that said, for pregnancy, I would definitely recommend doing them every day. There are a few different types that you can do, but focusing on that squeeze and lift and being able to hold that contraction is really important to be able to strengthen those muscles and stop things like leaking. So that will look after you in the postnatal period as well, once you've had the baby. Even if you do have a cesarean delivery, if you don't have a vaginal birth, remember that you've still got babies sitting on your pelvic floor for 9 months, and that's a bowling ball sitting on your pelvic floor. So that's a lot of weight, and your pelvic floor will be weakened as a result of pregnancy. So it's really important to do those strengthening exercises throughout pregnancy and after pregnancy as well, after giving birth.
Wonderful. As you mentioned earlier on, our pelvic floor exercises isn't something that you have to wait till after pregnancy. This is something that we need to be sort of doing on a daily basis to strengthen the pelvic floor during pregnancy, which
every woman should be doing their pelvic floor exercises every day.
Absolutely. I've actually got a book next to my bed at the moment on pelvic floor that I'm reading with a pelvic floor physiotherapist, Sue Croft, that I interviewed a few weeks ago. It's really quite fascinating.
I bet it is.
Yeah, but thank you for that reminder that we need to be doing this on a daily basis, even before and during pregnancy also. But I'd love to know from your perspective, what are the important health checks that women should have for every stage of life?
So I think definitely getting your pelvic floor checked is very important. So that's something that I always recommend after having a baby. So after about 6 weeks, so a lot of women get a postpartum check at about 6 weeks if they've had stitches and things like that. But I really recommend going and actually seeing a women's health physio and getting a good, thorough assessment to check that everything is healing well, and to check that your pelvic floor muscle contractions are improving. That's something that isn't mandatory in Australia, or isn't really regularly recommended, but it is something that is definitely recommended by physios because it is hugely beneficial. In terms of other health checks, not just for pregnancy but in all stages of life, I think that breast checks are incredibly important as well. So I heard a stat recently that during the whole COVID pandemic of this year, breast cancer diagnoses have gone down by 30%. And initially that sounds good, but 30% is a significant change, and ultimately it's reflective of the fact that women aren't going and getting their regular breast checks, and they're not going to the doctors like they normally are because of that fear of infection. So it's something that we really need to be monitoring, especially at the moment, when we aren't getting access to those healthcare services like we normally are. And I always recommend checking your breasts yourself for lumps every single month. I like to tee it up with a stage of your menstrual cycle, because your breast can change a little bit throughout. So it's important to say on the first day of your period, just to check to make sure that everything feels the same as it did the month before. And if you do notice anything strange or different to the month before, to really go and get that checked out by the doctor as well, because that, as I said, the 30% drop in diagnoses isn't a positive. It's a worrying sign that the numbers will spike again once things return to normal.
Yes, absolutely. I've heard so many people say the hospitals themselves, many of the hospitals have been sort of quite quiet, where they would be sort of emergency wards and all those types of things would be sort of quite busy, just purely because people are trying to avoid obviously any exposure to the virus. So this has been a really great chat, as always, Rach. If you were to summarize, I guess, your key messages for anyone watching and listening, what would they be?
Yeah, so I think ultimately it's being understanding that we don't need to be on bed rest for the entire 9 months of pregnancy, as you said. When you're pregnant, you're not broken, you're not sick, you don't have a condition, you are pregnant. And so if you're feeling well, and if you have been all cleared and you're medically clear to be able to exercise during pregnancy, then it offers huge benefits. It puts your body in the best possible position for pregnancy, for labor and beyond. And so it's really something that offers huge benefits to both mum and baby. And that said, I guess being mindful that we don't need to intensely monitor our heart rate during exercise when we're pregnant anymore. It's all about listening to your body. Remember the Borg scale. You want to be working at somewhat hard intensity. And if that feels a little bit too complicated for you, think of the talk test. If you can't maintain a conversation when you're exercising, you're working too hard. If you're sweating, if you're hot and red in the face and puffed out, you're working too hard. Your body will tell you when you're working too hard. So you just need to make sure that you're listening to the messages that it's sending you.
Yes, and to listen to your body and to stop exercising immediately and consult your doctor before even wanting to start exercising when you're pregnant. And then, of course, if you're feeling unwell during exercise. And
Absolutely.
As in your article, you do list a whole heap of different experiences that women may have. For example, bleeding, regular pain, contractions, or any sign of preterm labor, any severe pubic or back pain, shortness of breath, especially. And you mentioned this in the article, especially if you were experiencing sort of shortness of breath before exercising, any chest or stomach pain, calf pain or swelling. Of course, if you're feeling dizzy, and as you suggested, walking is probably the best exercise for any pregnant woman. But if she's having difficulty walking and any muscle weakness that's affecting balance, of course, all of these things you need to speak to your doctor about. And of course, if you notice the baby has reduced movement after exercising. And of course, we know that women are very tired during pregnancy, but if they're experiencing extreme tiredness, all of these things, as mentioned and as listed in your article, which of course we'll have a link to in the show notes, you need to consult your doctor immediately. So if anyone's got any questions for you, Rach, whereabouts can they find you?
Yeah, so I'm over on Instagram at Mana Women's Wellness. You can find me there. Always happy to answer a DM and have a chat if you've got any questions. I also have a podcast, the Mana Women's Wellness podcast, where we go really deep into all things pregnancy, periods, pelvic floor. We talk about a lot of these topics on there as well. So give that a listen too.
Wonderful, Rach. We'll have all of those links in the show notes. Thanks again for the chat, and look forward to catching up again in the not too distant future. But until then, stay safe, stay well, and speak to you soon. See you later.